Hello, my name is Dr. Vanessa Phua. I'm an aesthetic physician at Asian Health Partners. I've been practicing aesthetic medicine for the last 8 years, and most of the patients I see come and see me to rejuvenate themselves, to make themselves feel and look a lot younger and a lot happier. I'm also the trainer to several doctors in Singapore and in the region for certain aesthetic procedures, ranging from filler rejuvenation to ultrasound lifting therapy for the face and body. Today we're going to be talking about lipocryo. It's a non-invasive technique of actually freezing the fat cells using cryolipolysis. Today I have Cecilia here, who is a patient, and we're going to be discussing on body contouring and weight management. Hello Cecilia.
Hello, Dr.
How are you
Phua.
today?
I'm fine, thank
Okay,
you.
great. So today you have some concerns that you'd like to talk to me about.
Yeah, I'm very curious about this lipo things, whether how can it help me to body up my fats in the body?
I see. So you like to be slimmer?
Of course.
Yes. Okay. What we're going to be talking about today is lipocryo. Lipocryo is actually a non-surgical way of actually freezing the fat cells, so it's permanently gone. So what it does is actually a non-surgical procedure which helps you in body contouring. So you lose all the excess love handles and you shape your body so you get the curves in all the right places without the surgery and the downtime. What it does is this transducer head here actually is applied to the problem area, and at a vacuum the temperature actually drops to 3 degrees, so it pinches the fatty area at 3 degrees Celsius at a vacuum. And then when that happens, the fat cells will be frozen. And when this is removed, the fat cells you will feel are a little bit hard and a bit frozen, and that will actually cause the body to eliminate the cells permanently.
How long will the whole process take?
Let's say for the tummy, if the tummy needs 4 or 6 segments, probably about just over 2 hours for the tummy alone. And this procedure has no downtime, so that's the beauty about it. However, the results are more sustainable if complemented with a healthy lifestyle and exercise.
Does it suit everyone, even those with some slightly health problem? Because you see, high blood pressure is rather common nowadays. Diabetes are common nowadays. So is it safe for them?
Yeah, because it's non-surgical, we take away the anesthetic risk, and also if the high blood pressure and the diabetes are well controlled, it is quite safe. But people with diabetes bruise easily, so when we actually do this procedure, when the fat is pinched by the transducer, they may bruise a bit more than most people.
Lean your head against it, yes. Then you pull down.
And now we're measuring Cecilia's arms. The arm is actually an area of concern for her. For other areas that are amenable to treatment, which are commonly requested for, include the tummy, the bra bulge at the back, as well as the inner and the outer thighs. These are the common areas that we can actually treat with the lipocryo machine. So after taking the measurement, we will start the procedure. This is a lipocryo device that we're going to use to treat Cecilia's arm today. This is a fat freezing device that uses cryolipolysis or fat freeze to freeze the fat cells so they go away permanently. An average of 2 to 3 sessions is required for most patients before they see a 20 to 30% reduction in fat cells that is permanent. So what we will do now is we'll start the procedure. This cooling gel acts as a coupling gel that will help the transducer get a better vacuum. So the transducer will be applied onto the arm. And the area of concern will be treated under a vacuum. So she will initially feel a tight squeezing sensation. Can you feel that, Cecilia?
Yeah,
How does it feel?
it's still comfortable. It's not that pain or whatever. It's just normal feeling of your vacuum cleaner something.
Ah, I see.
It's just a light feeling.
So we'll just support the arm now. Does it feel a bit cold?
Yeah.
Yes. So this is the area of concern that is treated under a cold vacuum. So this is the principle of the lipocryo treatment. We freeze the fat cells. This stays on for 33 minutes. and then we'll release the transducer when the treatment is done. During the treatment, the patient can also watch a movie of their choice to keep the patients entertained while having the fats frozen. And we will release the transducer because the treatment is done. And the patient has been kept very, very comfortable over the last 33 minutes as we release it. You can see the area is just mildly red. Other downtime, there is no bleeding or crusting or any soreness of that sort. So this is a nice reaction that we like to have to actually indicate to us that the fat cells have been frozen. It may stay this way for about a day or so, but there is no restriction in normal activities. So you can go back to the office, you can go back to your shopping and your housework as per normal. And the results take about 3 to 4 weeks to start to evolve before you see any obvious results. So as we reiterated from before, an average of 2 to 3 sessions is required before we see 20 to 30% loss of fat cells and fat percentage. Okay, we'll remove this now. And then we'll clean the area before we start the next segment. Are you feeling okay, Cecilia?
Yeah, everything is fine.
How does it feel? Is it comfortable or
It's
cold?
just cooling.
Just cooling, huh?
Not very that cold as 3 degrees, but it's very cooling.
Didn't feel like it was frozen, but it was comfortable.
Yeah, it's comfortable.
Quite tolerable.
Yeah, it is.
Okay, now that all this is done, it looks good, right? We can cover you up now. I will see you again in about 4 weeks' time for a review, where we will remeasure, and then we'll start the second treatment then.
Okay, see
Okay,
you.
yeah, thank you so much.